if the patient cannot move their hand, there's not much point trying to do active hand movement and expect that functional MRI will do magic and show a function a patient can't do. And there's really two reasons in our experience of why a functional MRI scan fails. Number one is the patient either isn't able to or does not perform the tasks that you ask them to do in the scanner at the level or in the way that you want them to. And the second reason is head motion. And both of those can be addressed quite easily with a little bit of preparation and a little bit of explanation.
Hi, my name is Christopher Anderson. I work as the marketing manager at NordicNeuroLab, and today we're interviewing Natalie Voets. She works at Genesis Care, and we're really excited to hear more about how they use our product, but also how they use clinical fMRI in their practice. So thank you for joining us, Natalie.
Thanks so much for the invitation.
So let's just head straight to the questions. What is your current role at Genesis Care and what is your background?
So my background is that I'm a neuroscientist specialized in neuroimaging. I trained at the University of Oxford, where I got a degree in experimental psychology. And I was very lucky that I was able to go straight into a PhD, still at the University of Oxford, but at the fMRI Centre, which is the Functional MRI of the Brain Centre. It's currently rebranded as WIN. And my PhD project focused on patients with a type of epilepsy that cannot be managed with medication alone, and therefore they need to have brain surgery potentially. So the idea of the PhD was to explore methods such as functional MRI as a way to identify structures and areas in the brain that are important for and relevant to functions like language and memory. The reason is that at the time that I was doing this, the only alternative was essentially an invasive test where they put half the brain to sleep and then the other half in order to assess which side has language. And in the interim, so since then, work from many groups and a little bit of our research as well has shown that fMRI is a valid alternative, at least for language, to this invasive test, which is called the WADA or Amatel test. So my background is in neuroimaging science, and through that worked a lot with neurosurgeons. So through that pathway, I became the specialist advisor in neuroimaging when Genesis Care opened a centre in Oxford that had a focus on becoming a specialist neuro centre. And so one area that's always a difficult one to fill is to bring advanced imaging into practice. And so they bought a Siemens 3T MRI system with the facility to acquire functional MRI being high on the priority list of the surgeons. So we got in touch with NordicNeuroLab in order to set up a dedicated advanced imaging center that would have these types of sequences, especially functional MRI and diffusion tractography, added, which give additional information to normal diagnostic scans. So the idea is that we can identify structures in the brain that are important for these additional risk assessments in patients who are considering undergoing mainly neurosurgery, but potentially also radiotherapy treatments. So that's my role. And I set up that service and I take care of all the functional MRI that happens there.
Really good. That was a really good explanation. And in the reason why I contacted you, or we contacted you, was that we came across a video that we found on the internet explaining fMRI, which we found was really, really good. So, and when we discovered that you're actually one of our customers, we had to reach out. And when it comes to clinical fMRI, there are some issues that have been reported in different studies and so on. Could you elaborate some of those issues and talk about the measures you've done in order to reduce that?
Certainly. So with functional MRI, as with many types of tests, there are pros and cons. Many medical tests are essentially passive, so the patient just shows up and undergoes whatever the clinical team needs them to do. Whereas for functional MRI, the success of acquiring a good scan really depends on the active participation and appropriate participation of the patient. So in the literature that you're referring to, I think most of the issues that have been highlighted is failures of functional MRI. And there's really two reasons in our experience of why a functional MRI scan fails. Number one is the patient either isn't able to or does not perform the tasks that you ask them to do in the scanner at the level or in the way that you want them to. And the second reason is head motion. And both of those can be addressed quite easily with a little bit of preparation and a little bit of explanation. So rather than simply telling the patient, here, you're having this done, we have taken a different approach of trying as much as possible to make them feel an active participant in their own care and in the team work that we're doing, so they become motivated to help with their own care. So some of the strategies that we've taken is to really try and explain to them the purpose of this scan, why they're coming for yet another MRI scan, since they've had one potentially quite recently, which is diagnostic. So explain to them exactly what the information is that we hope this scan will give us, that we will show and talk through the results with them, and how we will use those for their own treatment plan. And usually that would be in the context of surgery or planning a treatment to spare areas in the brain that are relevant to them. So we try to tailor the experiments, of course, but we explain this process to them as well. So the other types of things that we do is try and go through with them and set the expectations for what it is that we hope when we do an experiment, which we will practice with them before we go in the scanner, so they know exactly what they're going to see in a practice fashion. We explain what it is we hope they'll do during each period of the task, and also what it is we hope they won't do. So I give very concrete examples with what it is that they should do. Many of them are language tasks, since that is what fMRI has shown particular use for. In the language tasks, however, most of the time, we're going to ask them to just think of the answer, not tell us out loud, which is very counterintuitive. And so we explain very clearly why that is, and it relates to the movement of the head and therefore confounding our analysis. But we also explain that when there are other parts of the test, they might not need to do anything at all and proactively not do something. So when we're doing functional MRI, often it's think of some words and then look at a cross. And when they're looking at the cross, they're supposed to have their mind as blank as possible, which of course, if we put you or myself in the scanner and you've got this loud clunking noise happening around us, either we're wondering what's going on, or we might mind wander, what shall I have for dinner? What time must I go get the kids from school? And those kinds of activities are natural, but are a problem for what we want to assess. So I explain to them why that is, because we're comparing what their mind is doing when they're doing our task and when they're not doing the task. I also try to anticipate common misunderstandings and things they might worry about. Sometimes they won't worry if it's think of words beginning with a certain letter and they worry they might swear. I explain to them that we can't tell individual words. We can only tell approximately what they're thinking. So it does not matter that much for some of the experiments if their performance is very high. We just want them to try their best and continue to do their best. And I explain in particular what are the problems. The main one being head movement. Like I said, it's easy to address by making the patient very comfortable to begin with, giving that extra 1 minute to get the padding right and to check once we've put the head piece of the scanner with the mirror on it, that they can see is very helpful. The NordicNeuroLab system actually has NordicNeuroLab written down the middle of it in the correct way for the mirror to show it. So I ensure that when their head is in position with all the nice padding, they can see through the mirror without having to lift their chin. That's one of the main issues. If they have to read every time something and adjust their chin and then put it back, that's a huge problem for functional MRI. So explain it to them, why they shouldn't do that, why we're going to spend extra time preparing, and that addresses those problems. In order to sort of make this a smooth kind of process, we made videos also for patients, like you mentioned to begin with, that are targeted. There's one set of videos for people who want to refer their patients, and there's a separate set of videos for patients themselves, so that before they come for the test, they're fully prepared if they want to see some videos of how we've put a practice participant through the process. They can see approximately what they'll be expected to do, how long it will take, what it will look like, and what we do with the data in order to have them come prepared with any questions they might want to ask about it. We set aside maybe 10 to 15 minutes before every scan so that we can chat through any questions the patient may have, address any concerns or misunderstandings that perhaps they had from watching the videos or from not watching the videos. And we tailor those to the patient's level. So if it's somebody who is very fascinated by the elements of how that works and how can we do that with an MRI machine? How come they've never had this before? Then we'll address a little bit to motivate them. And others may be just really worried about, am I going to do this right? And so for those patients, I spend a bit more time explaining how the functional MRI experiments sit in the bigger process of their full medical testing, which would usually also include some neuropsychological testing. So hence I reassure them that the performance, we're not trying to see how good they are at any of the tests, although of course performance matters. But we just want them to activate their brain as much as we can, and how that fits in then with awake testing. And all of it is a process, and they're a key team player as part of that big process. So that's what we've implemented. And the way that we have felt that has helped, to be honest, it's difficult to measure it unless you do it both ways. And of course, I don't do it without this process. But in the literature that you mentioned, there are sometimes surprisingly high rates of failures that are sometimes published. In our experience, these failures don't happen unless the patient isn't able to perform the tests. And that really should be addressed already before they come to fMRI by virtue of having been assessed properly, either with at least a short baseline in clinic or through ideally a more extensive neuropsychological evaluation before they come. If the patient cannot move their hand, there's not much point trying to do active hand movement and expect that functional MRI will do magic and show a function a patient can't do. So this is one aspect that's important to try and tease out, and that, if you can modify the experiments, if you've got the technical support from NordicNeuroLab or the expertise yourself to adjust these experiments to what the patient can do, then explaining properly the head motion situation and what the patient can do to minimize that, in our hands, essentially eliminates that problem. If your patient is very, very unwell and they can't lie still, they're probably not a suitable candidate for functional MRI to begin with. So knowing who's the right person and doing these sorts of steps should take care of most of the issues that arise in our experience.
I think that going through and listening to those measures is important, and trying to implement some of them, and just trying to do something active to better prepare the patient in such a way that they are more confident going into that maybe new environment or new task that they're been given by doing the functional fMRI. I think that's super important, because by viewing it from the patient's perspective, saying that I need this amount of knowledge in order to perform well, and you provide that sort of, as a team, as you mentioned, creates a better end result than if you don't do it. So
in our experience, yes. And that is the single question I get asked the most by the patients at the end of the scan is, did I do it well? Did I stay still enough? And so we ask patients in between every scan, before we do the next scan, how did it go? They can tell me straight away if they weren't able to see something properly. I mean, that shouldn't happen because we tested it before, but things like that. And I also keep the window open as we collect the scans to check the images to make sure they're not moving before it's too late. Once we've taken them out, it's too late. So we try to address it that way. And the patients usually do very well. And they are more reassured, as you say, before they go in, as to what we want them to do and how we want them to do it. And then they tend to do it very well. Yeah.
And that's, I think, the way that you actually take in the role that's saying, okay, we are going to support you through this scan, and really being almost like a coach through the process, gives them a confidence as well. Because for some people, this is really scary. They're there for a reason. And when you really made them aware why it's important and what they should do, then the chances for them succeeding is much higher.
Yes, I think certainly with most of these patients, the concern is about their quality of life. Most of the people that we see and that we would put through the functional MRI scans either have a brain tumor or have epilepsy that is quite severe and needs brain surgery. So if it's the brain tumor patients, many of them have just recently been diagnosed, and a lot of it is coming, a lot of information very quickly, a lot to assimilate, and what am I supposed to do and how do I do it and why do I need to do it? I think personally, I think that spending some time on the why we're doing this really helps with fears about much of the process. And at the end of the day, we're trying to do our best to maintain the quality of life. We can do lots of treatments, but at the end of the day, it has to be balanced, decided with the patient as to what is the right treatment for you, what are our end goals, and how do we get you there. Functional MRI is one of the tools that we use alongside tractography, alongside neuropsychology, alongside awake testing during surgery. And so using the right tool for the right question at the right time, explaining that to the patient, makes them part of the active treatment rather than just a passive experiencer of all the technology we have available.
What is your experience with using the fMRI equipment from NordicNeuroLab?
Right. Well, one of the reasons that we opted to go with NordicNeuroLab as the installer at Genesis Care for our new Center for Neuro was actually that it's a very easy to use piece of equipment, and the support and installation part of things was completely taken care of. And I was actually personally quite impressed with that side of things, because it's a difficult hardware problem to interface quickly and properly, and it was a very experienced team and very well installed. The other bits, we've been using it for about 18 months now, and I must say that although we had good coaching in the troubleshooting of technical issues that might arise, we haven't had any technical issues arise. So I think the ease of use of the NordicNeuroLab system is something that is definitely worth considering for any center wanting to put functional MRI in. It's easy to use. The other things that are advantages from my perspective in choosing it is that the implementation of a set of experiments and paradigms that are reasonably well validated in the literature just makes the whole process reasonably straightforward to do. In relation to that, for some centers who are already quite experienced with functional MRI and how to use it and what they want to use it for, it can be helpful to have perhaps a little bit more flexibility over adapting the experiments. I must say that, there are good and bad things about having preset experiments. Like I was saying, if the patient isn't able to perform quite so well, it can be an advantage to be able to slow down the task delivery, or maybe to swap out with easier pictures that they can name instead of pictures that they can't name. It is possible to get NordicNeuroLab support for that. It's definitely been offered to me. I ended up working it out and put in my own new experiments that I feel are important to use, but that's one thing to consider for a center. So other experience, I must say that both the patients and myself have enjoyed the comfort player aspect that NordicNeuroLab offers. So the non-paradigm set where you just have videos it's something I always use in a functional MRI scan before and after. It distracts the patients, and it makes the whole scan, which is actually longer than a diagnostic scan, pass in the patient's experience faster. So we've liked that very much. And I use it also for non-fMRI experiments.
Well, thank you so much for this, Natalie. It's been a pleasure, and it's I would like to say on behalf of NordicNeuroLab, we're really proud of having you as a customer and the way you work, and we hope that people really take some of the measures and try to implement them themselves, and hope that they get success as well. Successful scans means that we get better treatment, which is the best for the patient. So thank you so much.
Thanks for the invitation again.